Ask most people what their biggest retirement expense will be, and many will immediately answer, healthcare. But here's the surprising part. Many retirees who expect healthcare costs still underestimate them, not because they're careless, not because they are not financially educated, not because they failed to plan, but because the most expensive healthcare costs are often the ones retirees never see coming. It's not always the routine doctor visit. It's not always the annual checkup. It's not always Medicare premiums. Instead, it's the dozens of smaller healthcare expenses that quietly appear throughout retirement and slowly add pressure to retirement income. And over time, those costs can become one of the largest financial challenges retirees face. Today, we're uncovering the healthcare costs retirees rarely plan for, why those costs continue growing throughout retirement, and what smart retirees are doing differently to prepare. Because understanding these costs today may save you thousands of dollars tomorrow. Most retirement plans include healthcare. That's the good news. The problem is that many retirees only plan for the healthcare expenses they can see. Medicare premiums, doctor visits, prescription medications, routine care. Those expenses are relatively easy to estimate. The challenge is that retirement healthcare is rarely static. Healthcare evolves. New medications appear. Conditions change. Specialists become necessary. Additional treatments emerge. And because retirement often lasts 20 to 30 years, healthcare spending frequently changes as retirees age. The result? Many retirees discover that healthcare isn't one expense. It's an entire category of expenses. And some of the most expensive ones never appear in retirement projections. Let's start with one of the most common retirement healthcare surprises: prescription medications. Many retirees enter retirement taking little or no medication. Then over time, things change. A blood pressure medication, a cholesterol medication, a diabetes medication, a stomach acid medication, an arthritis treatment. One prescription becomes two becomes four, and suddenly a retiree is spending significantly more than originally planned. The challenge isn't always the cost of one medication, it's the accumulation. Each prescription may seem manageable individually, but over years, prescription spending can become a major line item in retirement budgets. And because healthcare needs often increase with age, medication costs frequently rise alongside them. If you find value in this content, please like and subscribe. I really would appreciate it. One of the most overlooked healthcare expenses in retirement is dental care. Many retirees are surprised to discover how much routine dental work can cost. Crowns, bridges, root canals, implants, extractions, periodontal treatment. Even basic procedures can become expensive. Vision expenses create similar challenges. Eye exams, prescription glasses, specialized lenses, age-related vision changes. These costs often arrive gradually, which makes them easy to underestimate. But over a long retirement, dental and vision expenses can quietly add thousands of dollars to total healthcare spending. And because these services are often not covered the way retirees expect, many people find themselves paying more out of pocket than anticipated. Another healthcare cost retirees rarely plan for is the specialist chain reaction. It often starts with one appointment, a routine concern, a minor issue, a recommendation for further evaluation. Then one appointment becomes three appointments become testing. Testing leads to additional follow-ups. And before long, healthcare spending begins increasing across multiple categories. Not because something catastrophic happened, but because healthcare naturally becomes more complex as people age. This is one reason retirees frequently underestimate future healthcare costs. They focus on today's needs, but retirement healthcare is constantly evolving, and each new layer can introduce additional expenses. Now let's discuss one of the largest healthcare surprises in retirement: home healthcare. Many retirees assume healthcare occurs primarily in hospitals and doctors' offices. But a growing percentage of healthcare spending occurs at home. Assistance after procedures, recovery support, medical equipment, mobility assistance, temporary caregiving, food preparation services. These costs often appear unexpectedly, and because they frequently occur later in retirement, many people underestimate how much financial impact they can have. Even short periods of home health care can create significant expenses, and unlike many other retirement costs, these expenses often arrive during periods when retirees are already dealing with health-related challenges. One reason healthcare becomes such a major retirement concern is because multiple healthcare expenses tend to increase simultaneously. Prescription costs rise, dental costs rise, vision costs rise, specialist visits increase, healthcare inflation continues, and over time, retirees often discover they need more money simply to maintain the same level of care. This doesn't happen overnight. It's usually gradual, year by year, expense by expense, which is exactly why so many retirees underestimate it. The biggest healthcare costs are often not dramatic, they're cumulative. And over 20 years of retirement, cumulative expenses can become substantial. The retirees who handle these challenges best understand an important principle. Healthcare planning is not a one-time event. It's an ongoing process, because retirement healthcare continues evolving throughout retirement itself. The healthcare costs retirees never see coming are often the ones that create the greatest strain on retirement budgets. Prescription medications, dental care, vision expenses, specialist visits, home health care, and the countless smaller expenses that accumulate over time. The good news? Awareness creates preparation, and retirees who understand these challenges early often make sound decisions like reviewing medical and dental coverage regularly, utilizing preventive services, opting for generic prescriptions, and exploring cost assistance programs. Because retirement success isn't just about building wealth, it's about protecting it when life changes. Remember to always be prepared financially in this difficult economy, because the cavalry is not coming to save any of us retirees. If you found this video helpful, subscribe to The Wealth Perspective for more retirement planning, Social Security, healthcare, investing, inflation, and retirement income strategies. I really appreciate you watching the video. Thank you.